All right. Well, hello, everybody. Welcome. My name is Erica Ferriston, she, her. I am the director of Healthcare for All Los Angeles, along with Maureen Cruz. Co-chairs are Bronwyn Major, Cheng-Sim Lim, Gina Harris, and we have a whole incredible, amazing leadership team. Healthcare for All Los Angeles is a local chapter of Healthcare for All California, a statewide nonprofit, nonpartisan organization. Our mission is to achieve a universal healthcare system through single-payer public financing, with the goal that all California residents have comprehensive, high-quality healthcare. And then, as they say, as California goes, so does the nation, and we will get Medicare for all. So before we begin, we're going to start tonight with a land acknowledgement. So if everyone would go ahead and just center themselves. We at Healthcare for All Los Angeles respectfully acknowledge the Tongva and Kizh peoples as the traditional caretakers of the land that we currently reside on. That is the Los Angeles Basin and Southern Channel Islands. They lived harmoniously with these lands and waters for countless generations before the onslaught of colonization. Like indigenous peoples across the Americas and most of the world, they experienced genocide, ethnic cleansing, theft of their land and waters, and forced removal. Our ability to live, work, and enjoy this area is connected to their deep loss. We seek and ask all in our community, including our governing bodies, to learn about, to honor, and respect the land and the courageous people who have been its stewards, modeling a tradition of resistance seeking liberation. We pay our respects to ancestors, elders, and relations past, present, and emerging. We resolve to work with the Tongva and Kizh people to build a shared sustainable future for all. And if you are outside the greater Los Angeles area, you can find out whose land you are on at native-land.ca. So thank you for that. The format for tonight is we are going to listen to our speakers, and then we will have a question and answer at the end. So when we get to that point, for those of you on Facebook, please drop your questions in the Facebook comments, and Paul Newman, Paul, if you want to give a little wave, he will ask your questions for you. And for those of you on Zoom, drop your questions in the chat and I will ask your questions. Paul and I will alternate between Zoom and Facebook to kind of just keep it even there. And I think we already are, but one more time, please, everyone, but our speakers, mute yourselves. And with that, I'm going to turn it over to Maureen Cruz.
Hello, everyone. Thanks so much for joining us tonight. I'm going to do a little bit of an introduction here. So health is about well-being and having what we need to thrive. And hope is what we need to remain healthy when in challenging circumstances and conditions. And healing involves caring for one another and is what healthcare justice is all about. So dedicated to single-payer healthcare reform to deliver just, equal, comprehensive healthcare for all, Healthcare for All Los Angeles recognizes the intersectionality of all elements necessary for the health and well-being of our population. Our friend and mentor, Akili, has famously reminded us that historically, all has never meant all, but history is being rewritten every day by us and by what we do. So it is our aim to write a history where all means exactly that. All means everybody in and nobody out equally. It's not possible to progress towards justice in any other way. So among the most marginalized, misunderstood, neglected, maligned, and often abused community is that of our brothers and sisters trapped in the incarceration complex. Whether in pretrial detention, while imprisoned, or after release, the incidence of medical neglect is exacerbated when its victims are housed and treated separately, out of sight and out of mind from the general public. So whether inside or outside of prison, barriers to care are surprisingly similar. Co-payments and fees deplete financial resources, understaffing, racial bias, dismissal of symptoms, lack of adequate mental health services, disrespect, delays, and denials inside and outside the cage can lead to preventable disability and even unnecessary death. And we know that does happen. We know that racism, classism, poverty, food insecurity, homelessness, lack of education, environmental destruction, labor abuses, the experience of violence, and the lack of a safety net are the context that determines our health, well-being, and access to healthcare. These are the same determinants that fill our prisons, jails, and detention centers. As prison abolitionist Ruth Gilmore writes, we only need to change one thing, and that is everything. So the intersectionality of all issues of human need is inescapable, and to reimagine and rebuild a just healthcare system means that we must transform the social, political, legal, and moral context in which we all live. We must replace the harsh carceral system of dehumanization, punishment, and stigma that divides us, damages health, destroys hope, and prevents healing. In an enormously impactful 2020 policy statement, the American Public Health Association argued for the abolition of incarceration in the United States. They stated, independent of COVID, we're talking about a criminal justice system that actually spreads poor health by design. In 2005, California's system was put into federal receivership by a judge, labeling the system a disgrace, the prison system for healthcare, a disgrace, with substandard care and high mortality rates of inmates. James Baldwin said, it may be that not everything that is faced can be changed, but nothing can be changed until it is faced. So in the struggle for healthcare justice for all reform, we need awareness, education, and action. So it is our very good fortune tonight to be educated by two inspirational reformers who focus every day on the rehabilitation of our prison system and who assist those within this system in getting what they need to be well, to maintain hope, and to heal. This essential work strives to ensure that in healthcare justice, all means all, and that care means building community, not cages. So it's an honor and my deep pleasure to recognize and celebrate the incredible humanity of our guest tonight. Let us welcome Geri Silva. Geri, can you wave? And Marvin Mutch. Marvin, can you wave? So Geri and Marvin, you each came to involvement in justice for those trapped in the prison system from very different perspectives. So I'm going to start by asking Geri, will you tell us how you became involved in prison issues, when you became involved, and what motivated you?
Yeah, that's a hard question to, oops. Oh, why am I muted?
No,
Oh, okay. I just saw something across my screen. Anyway, that is kind of a hard question to answer in as much as I came to justice work, and this was a natural place where I was going to come. And that was very early in my life, and some of it through just personal experiences. And it was about, let's see, in 1985, when my best friend's brother was shot and killed by police, shot 7 times in the back, for which, of course, there was no prosecution, no accountability. Following that, he was prosecuted and put in prison, my best friend, for a crime he obviously didn't commit, but being Black, it didn't really matter. His brother was Black. It just doesn't. That was, business as usual. So we gathered in support for him. And I became so familiar, which obviously Marvin is from personal experience, with the courts, the prosecutors, the judges, and the just absolute inhumanity and so far from justice that I no longer call it a criminal justice system. It's a criminal legal system. So I got, right then and there, I knew I had to do something about what was going on in the courts. And in as much as he went to prison, my work segued into that as well. We formed a group called Mother's Rock, which Ruthie Gilmore writes about in '92, just around the time of the uprisings. And Mother's Rock was for families of young men and women, older men and women who were forced into this, criminal legal system by the police through prosecution into prison. At the same time, very soon after the 3 strikes law passed, a flood of mothers and wives came to us, unimagining that anything like this could ever happen. How can my son be facing 25 years in prison for taking razor blades? And the stories abounded. We formed a group called Families to Amend California's 3 Strikes. I've since formed other family organizations. I get confused. Within Families to Amend California's 3 Strikes, grew Fair Chance Project, which was an organization that was dealing with incarcerated lifers, people that had, any number of years to life and were not coming home because the parole board wasn't trying to let them go. And the governors really weren't trying to let them go up until Brown. Fair Chance Project, within that, FUEL, Families United to End LWOP, was formed. And that was to address the other death penalty, which is, death by incarceration. The death penalty has 2 sides: death by injection, death by incarceration. So this has been so much a part of my life that I don't know where it began. I just know it won't end until I do.
Okay, thank you, Geri, and thank you for your passionate dedication to justice. So, Mr. Marvin Mutch, you came to prison issues from a very different background. You were wrongly incarcerated, but how did you become involved in prison issues while in prison, since not many in prison become involved as you did? So when did you become involved in the solutions for making things better, and what motivated you? And also, tell us how you became a prisoner.
So, is my voice coming through for you guys?
Yes.
Okay, great. Because I have to use my phone. Everything's in transition in this office. I'm transferring all my files to a new computer. So, and this is a new phone. So I just got back from Best Buy with this phone. So I'm trying it out now. I always have to go back because it's important when we're talking about the path people go down and where they eventually end up. It's important to go all the way back and try and figure out how you came to be on that path and how you can recognize the signposts that tell you which way you're going and what's at the other end. I'm the 2nd generation of my family that's been imprisoned. My mother's a Holocaust survivor and was interned during the war and was liberated when the war was over and brought to Yakima, Washington as an orphan, where she stayed in an orphanage until she was 18. She met my father in the orphanage. They were married and I was born. And when my sister was born and I was 2 years old, they divorced. And I'm sure he loved her, but he just could not contend with the ghosts and demons of a life that was robbed of love and nurture. My mother was had a lot of physical and emotional issues, and she left Yakima for California with her 2 babies, and she found herself here trying to start a life, a young single mother. But she was often hospitalized and absent, and I was stored in foster care, as it was my sister, for months at a time, sometimes years at a time. And I became a chronic runaway. There was a lot of abuse and other things that happening in the foster care system, and I became a chronic runaway. I soon became a ward at the court. And became a probationer, had a probation officer, and that led to me being sent to boys' homes and eventually the boys' ranch and to children's prison. Yeah, there's children's prisons. And fast forward, I found myself at age 19 in a prison cell where I would stay for the next 41 years. I was, like she said, wrongfully convicted. However, it was what it was. The circumstances are too long and lengthy to go into here, but when I got to the prison, I went to the law library as soon as I could, because I knew it was the law that put me there. And if I could just reverse engineer it, I could somehow get out, but it didn't work out that way. I met a law clerk who gave me some literature on the prisoners union, and I joined the action arm of the early prison reform movement in 1975. I was an activist and an organizer for the first 3 years I was in prison. In 1977, the prisoners union lost footing inside the prison, and a friend of mine who was with the prisoners union, John Irwin, gave me the platform for the prisoners union, and I took that platform and married it to a failed diversionary grievance system that the prison had, and created the Men's Advisory Council. And we started advocating for humane treatment and prison reform from the inside out. We asked to have elections, and the warden thought that was a ridiculous contention. And so we went to court, and we got a court order to allow us to have elections. I was elected to chair the first committee in the state and was reelected for 38 years. At the height of its population, our organization represented the collective grievances of 174,000 prisoners across the state. We litigated everything from higher education, exercise equipment, community standard healthcare, food that didn't require you to have healthcare after you ate it, those kind of things that are necessary. We weren't asking for back rubs. We were asking for simple human rights. And it was long and protracted, some of the fights, but we soon established ourselves. The math was pretty simple to explain to people. When we talked to them, I used to tell them about the number of people they have running the prison and the number of convicts they have. And the minute that we decided we didn't want the place to run, it wouldn't run. I mean, you have a building with 780 people in the cells, in the cell blocks, and you have 4 officers, a sergeant and lieutenant, that control 780 people. And it's just because of the way the system runs. It dehumanizes people, not just the public who pays for it, and the people that work there, but the people that are chained and caged come to believe that they are less than human and they deserve what they're getting. And fortunately or unfortunately did not fall into that. If you do not fall into that mindset, it's torture, knowing that you don't deserve this treatment that you're getting, and that it is not just immoral, but it's unconstitutional. And there's really nothing you can do about it because there's nobody hearing your voice outside the prison. So that's what I did for 41 years until the Innocence Project got me out in 2016. So I've been out 6 years. In 2000, a guy named Carlton Smith was writing a book about a serial killer that was on death row. And during the research of his book, it was he that found the evidence that showed it was indeed the subject of his book that committed the crime I was in prison for. And I eventually got to get out. But how I came to be involved in criminal justice work and trying to fix things started when I was a child. Abuse will either make you an abuser or it'll make you a fixer. And I happened to become a fixer. From my earliest recollection, I have always been an injustice collector. Things that are unfair will propel me right into the face of what's causing that unfairness. And it was that way in foster care and in juvenile hall and any other thing that any other select torture that they chose for me as a child just made me more resolute on trying to stop this unfairness and get somebody to hear what I had to say. So it was just a natural thing for me. When you first go into prison, there's this long protracted period of blindness where you're groping around trying to get your bearings in this dark place. Once I became acclimated to the dark, I saw the place was a minefield of broken lives. There were souls everywhere. And they were asking me to go with them and help fix this system. And so from day one, I was focused on all of the things that were broken that we needed to fix. And I never really had the chance to sit on my bunk and ruminate on the injustice of my incarceration, because had I done that, it probably would have crushed me. But I was simply from day one focused on these things that were not right, that they did not have the right to do these things to us. And so there was plenty of things to keep my mind occupied. And in 2000, after this book came out, the Innocence Project took my case. In 2006, my attorneys were unable to get any action or any traction in the appellate courts because it had been too long, too many decades. And so we did a Shawshank Redemption thing. We went to the board, we laid out all of our exculpatory evidence, and the board ordered my release in 2006. 2 days before I was supposed to leave, Arnold Schwarzenegger exercised his discretion as governor to reverse, and I stayed another 10 years. In 2016, Governor Brown reviewed the same package and let me out. My friend Deborah, now wife, met me at the gate, and she was my guide for the first 6 months I was out. She introduced me to everything from cell phones to spontaneous adventures, and I asked her out on a date after 8 weeks, and we dated for 8 months and got married. And but they did a documentary about my case, KQED, and they were there at the gate, and it was all very, very surreal. And I found that there was a second period of blindness when I left the prison. When I left the dark and came back to the light, you are blind again. that the light is debilitating. Everything, this sensory overload is too fast. I did not like people around behind me. Whenever I was in a room, I was at a wall with a wall behind me. Supermarkets were hell. They were hell. People in those carts, it was like I got ran into the third day I was out, and I actually asked, so what, you just run into people with those things and you don't say anything to them? And everybody's looking at me like I'm crazy. It's like my wife had to tell me, my girlfriend had to tell me, you can't, this isn't prison. You can't do that. So I learned right away that there is this extreme damage that happens in prison. I had a psychologist that I suffered from post-traumatic stress syndrome, and I begged to differ with her. I told her I don't have post-traumatic stress syndrome. She goes, everybody in here does. I said, listen, there's nothing post about what I have. It's ongoing traumatic stress syndrome. So let's change the terminologies here. And most of the things that I deal with can be fixed with a change of terminology and a change in focus, which is what I'm hoping we can talk about today. But since I've been out, I've become director of advocacy for the Prisoner Reentry Network, which is a full-time endeavor. I partner with another organization called Bonafide. We mostly pick up people at the gate who have been incarcerated for a long, long time. And we give them a smartphone. We take them to Target, get them out of their parole clothes into something that, you know, some street clothes, take them to breakfast, and then we put them on a train or a bus or drive them to their county. And we call somebody on the other end and we ask them to meet them and hang with them for 6 months and help them navigate, because they've already been through everything this person is going to go through. And we don't charge anybody, but we do like a Godfather thing. It's like, today, this is a gift on the day of my daughter's wedding, but there's going to come a day when we ask you for a favor. And so when we call somebody and say, hey, go meet this person, they do it. It's just not, we have about 11,000 to maybe 16,000 people in our network in different cities around California. So any place anybody goes, we have somebody that's going to hang with them and help navigate. And we figure between the county jail and prison, in 5 years, we've probably processed 4,000 people. And none of the people that we processed and had navigators for and assisted through the process went back to prison. And this is at a time when you have 67% recidivism. And so we have a system that last year cost us $13.8 billion to run 35 prisons. This year, we're on track to spend $20 billion. And we're giving them $20 billion to fail 67% of the time. So what we're doing is contrary to public safety. And anytime you have a system that ends up with more victims than it started with, it's broken. And
Really?
so I'll answer some more questions here. I can see this list here.
Really, really excellent. I mean, what you were able to do, to me, is absolutely phenomenal, since you started as a teenager. So both you and Geri have worked in programs for those that were incarcerated and also for those who are returning, like your prison reentry. Geri, I think that your Fuel, your Fair Chance project, is about folks when they are released, helping people as the Prisoners Reentry Network is for Marvin. But you also are working on a project, Fuel, which seeks to alter a seriously detrimental situation for inmates. And can you talk to us about Fuel, and also let us know, I believe you have a letter posted for Governor Newsom that relates to it as well. And tell us about Fuel. Oh, you're muted. You're muted.
Sure am. Anyway, I just wanted to tell Marvin, who I've spoken to a number of times, he's freaking awesome. So, you know, there's a good segment of the population that abhors the death penalty and the idea that the state kills people for being raised in this dysfunctional society and being dysfunctional. But they don't know that much about life without parole, which is the other death penalty. In it, you go to prison and you lose hope forever of coming home. You have life without parole. When you're sentenced, the judge says, I'm sentencing you to die in prison. And I've heard more stories from mothers who fell apart in the courtroom when they heard that their child, you're a child long after you're considered a child, is sentenced to die in prison. It's crazy. And it's something that we had to address. We were working with Fairchild's Project with lifers, long-term lifers. But within that category are people who have nothing to hope for. So it was important to address that. And in 2017, I would say before the move got underway, because now it's a strong movement in California. We have the Drop LWOP Coalition and major organizations that are fighting against life without parole. But it has been seen as the viable alternative to death by injection. When Mike Farrell was trying to get a ballot measure to abolish the death penalty, his measure would have then made everybody on death row get the sentence of life without parole. So they go from one death penalty to another death penalty. So we were kind of like forced to fight that, and we fought that along with many men and women inside who were fighting that, who did not want to, be there forever and had to have an end to life without parole. We formed Families United to End Life Without Parole, and it is families, and it's men and women inside who are working with us as well, organizing inside. Some of what Marvin was talking about, people that he knows, actually getting the word out inside, rallying people inside in support of activities that we're doing that will bring people home. Specifically, right now, there's a Senate bill that will take a bite out of life without parole, Senate Bill 300. I don't know what else there is to say other than a sentence this brutal is not practiced any place, many places. But this country, which is, touted as a democracy, and it's really a democracy for the few, has such a major human rights violation. And you're talking about the audacity to talk about Ukraine and what Russia's doing. Just so horrible. And you center around healthcare, people dying from lack of healthcare, and that's okay. Everything is wrong about the system. I can't find anything right about it. So yes, we are statewide. We are organizing to change the law, and we're empowering people inside and out, and definitely giving people with life without parole hope, because they know that if there are no other organizations fighting against this awful law, there is an organization called Families United to End LWOP.
Thank you, Geri. So Geri and Marvin, it's kind of a question for both of you. I'd like for each of you to comment on something that Lifers with Optimistic Progress have written. That's a group of those that have that sentence, life without parole. I was really surprised to learn that in fact, many men and women serving life without parole have themselves not murdered anyone or killed anyone. If you are with someone at the time, either before, during, or after someone is killed, then that person can also can end up with life without prison. And the sad, well, it's all horrible, but it's especially horrible to realize that the majority of those in this group have committed such acts during their late teens and early 20s. They were often on drugs or alcohol, some from very poor and abusive homes. Some were lost to the street at an early age, as was Marvin, even though he did not commit the crime. But some of them who were involved with crimes were lost to the street at an early age, forced to fend for themselves. They were victims of violence themselves. And so the comment from Lifers with Optimistic Progress, which is a play on words for LWOP, right, Life Without Parole, is that police, prosecutors, and most media have labeled us the worst of the worst monsters with no redeemable values and a cancer on society. In a small number of cases, that description may in fact be justified. However, the majority of us are loving fathers, uncles, brothers, nephews, sons, and grandsons who made serious mistakes in a moment of ignorance, committing an act or acts, yes, which may deserve punishment, but certainly not the slow barbaric death that California calls life without parole. This group contends that where governors, mayors, and the policing system have in large part failed the inner city occupants, something or someone else deserves a chance to prove they have plans that can make a difference. And that's what this group claims, is that after decades of experience of dealing with their own situation and the situations of others with life without parole, that there's a lot of knowledge there and that people should be given a second chance. I'd like for you to comment on that. Marvin, you want to comment on that?
On the group?
Or the group, or you know, do you feel that people deserve a second chance all in all, and that there should not be life without parole? What do you think?
Of course, I feel it. It's, you know, when I was a child, when everything started for me, it just seemed like everything kind of informed my journey. The first time I was sent to the boys' ranch, the judge told me at 8 years old that I was incorrigible and I was being sent to the boys' ranch as a minor out of control of his guardian. And so I went back to juvenile hall and I looked at incorrigible up. I couldn't believe it. I couldn't believe that really no chance. There's really no chance for redemption for this person. And so who says that to a child in the first place? But of course, nobody is beyond redemption. There's always a way to figure out how to fix brokenness. And of course, people, the fallen and broken men that are in our prison system are there because, for the most part, humanity has shown them the worst it had to offer. And they are broken. Their lives are broken. Their families are broken. Their worlds are broken. And it doesn't really matter at that point where you chain them and cage them, because the brokenness is internal and nobody's trying to fix that. We have to stop throwing lives away. We have to stop. I had a small victory in a whole mountain of injustice that you know we seem to be trying to climb over all the time. A young man got 90 years to life in Woodland 7 years ago. His family was devastated. He was a teenager. We just got a court to vacate his conviction, and he's going to be going back to the jail, and we're going to see about getting him out this time. He was wrongfully convicted as well, and we were able to find the evidence that showed that he was wrongfully convicted. And so from time to time, these things, you know, we were able to save somebody. We're able to reach in and pull them out of the undercurrent that is the carceral system that we have in California. But when you have sentences like life without, when you have the death penalty, it's ridiculous to say it's wrong to kill, and if you do, we'll kill you. What kind of whacked out double talk is that? It's wrong to kill, and if you do, we'll kill you. So you're really not, I mean, if you're going to stand from some moral high ground and point your finger at people, they should be able to look back and see mirrored for them the values that you're expecting of a person in this society. But that's not what's happening. What they see is vengeance. And I'm not a person who is going to discount the harm that some people have done and the harm that some people have experienced in their families and their lives. But this can't be all about vengeance. We have to do what we do has to contribute to some societal well. And that's not what's happening here. People are becoming more damaged, and the prison system breeds violence. If you weren't violent when you went to prison, you will be when you come out. It's just the way it is. I used to have a hobby where I'd watch new guards and new prisoners come into the prison, and I would watch to see how long it took the prison to overtake them. If you do not keep a lamp lit, if you don't have a purpose, you will become as dark as the place you're in or work in. So no, I don't believe that anybody is beyond hope. They may have a mental illness that is curable. We can fix that. They may have desperation. They may have an addiction. They may have demons that are pursuing their life. But we as a sentient society cannot turn our backs on that suffering. You know, brokenness is not something that we need to hide. I tell people that all the time. You need to talk about how you got where you are. The Japanese have this wonderful thing that they do where they take broken vessels, these bowls and cups, and they will repair them using epoxy and gold. And when they're done, there's these gold veins that go all through the vessel, and it's whole again. And the brokenness is now worth more than the vessel. We will forever miss the point of what we're supposed to be doing in this life if we do not see these things, these signs, and learn from them. If we're to believe we have any purpose in this life, is to take that which is bad and make good of it. And so throwing lives away, that's contrary to that maxim.
Thank you so much, Marvin. It's so eloquent. Geri, did you have any comments to make about that?
Yeah, I'm a prison abolitionist. So that does not mean opening the doors and letting everybody flood out. That means prioritizing communities that send people to prison regularly. It's part of what Marvin was saying, but I will never say prison is where some people belong. And that's how we handle some people. And well, what are you going to do with all the criminals if there's no prison? And what are you going to do with all the street criminals if there's no police? You're going to prioritize where your damn money goes. And then you don't need those things. Who said we need prisons? Who said we need police? Who has a fair chance? And actually, I had a discussion with one of the founders of Lifers with Optimistic Progress because he wanted us to promote a ballot measure around, or whatever, ballot measure legislation around LWOP that would focus on, first termers. Excuse me, the people that were there for the first time. And so second chances is their big, word, second chances. Well, ask a Black man in America if he ever got a first chance. Who gets a first chance? Who? It's just not. It doesn't happen. It doesn't happen to the native. Didn't happen to the native people you spoke about. It does not happen to a certain set of people in this country. They can always pluck some out and say, "Yeah, well, look at it. I'm so tired of that. Trying to justify everything they do by saying, yeah, but look, Arthur Ashe or whatever." And Arthur Ashe, actually, the tennis player, made the comment when he got AIDS. He said, AIDS is nothing to the challenge I face as a Black man in America. So I want to personally stay away from, I am not a reformer. I don't want to reform prisons. Just like you all don't want to reform the healthcare system. You want healthcare for everyone. We all deserve it. It's so much wealth in this country. And it really all comes from the fact that wealth is in the hands of the few. That what we produce in this country, we produce for those who can pay for it. It's insane. So I kind of bristle when we're talking about, like, let's give some a second chance, and yeah, well, some deserve to be in there. That's, we're too late with that. Let's start by making sure communities of people get exactly what they need, what the wealthy communities get, and then, yeah, sure, wealthy communities, there's drugs and there's all this, but if you had a healthy society, it wouldn't be there. It would be. If I was like a wealthy white person and I saw what was going on, I'd want to get high all the time too. So I don't know if that's the answer you were looking for, but
Thank you. Yeah, we're looking for what you think and what Marvin thinks.
Yeah,
I
would say this, that we have a pipeline that leads right to the prison. But I will say this as well. We have to change the hearts and the minds of the centrist majority that we have in this country. We can't scare people at the beginning of this. I came to the conclusion a long time ago, revolution is not going to happen in the streets. Revolution has to happen within the thing you're revolting against. If you do not like the carceral policies of your state, then you start installing progressive DAs. If you do not like the prison system and the effect, the 67% of the people that come out and ravage their communities and go back to prison, then you do something about the effect of prison. When I first went to prison, every single lifer I knew in 1975 when I walked into San Quentin were Vietnam vets. They came back from the war and nobody turned the switch off, and they had a problem. Somebody broke in my truck, I will kill them. Somebody disrespected me, I will kill them. And they go to prison. If we know, and we do know, that war does this. If I had my way, we wouldn't be in other countries killing people. But since that's what's happening, why is it today, if you go to San Quentin or you go to Folsom or Soledad or any of the other prisons and talk to lifers, you're going to find people that were in Afghanistan and Iraq and Iran, and they came back and they killed people. And yet we're not doing anything. If we know that war does this, why are we not doing something at this end of the process to mitigate the effect of that? And the same thing with prison. If we know that this darkness invades people and takes them over. And when they leave prison, they are worse for the wear. I mean, look, we are dealing with people in the public that do not have the perception that we have, even in this group right here. And so they don't have our perception. So we can't scare people. Jeffrey Dahmer was eating people, and the Night Stalker was crawling in windows and killing whole families. For the $13.8 billion we spent last year, I, for one, would like to know what was torturing their life to make them do that. What was torturing their life? They weren't born serial killers. They weren't born murderers. What happened? And if we don't find that out, we're going to keep filling prisons with people who have this chasm in their life. You know, they fell into the darkness, and all they know is dark. And so, and then when we make it worse, we have people who get invaded by darkness in there. And when we parole them, we're releasing mere shadows in a world of light. And shadows do not survive in light. So they need darkness. And so we have to figure out what we're doing. We have to try and fix this brokenness in the communities, like Jerry was saying. We have to try and figure out, you know, that we already know from science, is just now catching up with something I've always known, is that the effects of my mother's internment are intergenerational. And the same thing with these young people. You talk to them, their grandfather was in prison, their father was in prison, their brother's in prison, their uncle was in prison, and they're going to go to prison. That's just the way it is. It's the way it is. Why do we accept that as being a reality, as something that we really can't change? Well, it's a, you know, we don't have time to save every starfish, right? So let's just ignore all of these people over here, you know. But I think the problem is we have to, we can't stop our revolution with one part of the equation. Where did these people come from? Where did the Night Stalker, what path did he come down? We need to boot up and go down that path and see what's going on in there. Yes. What happened to this guy's life? And when you get to the other end, you're going to find children lined up waiting to come down that same path. And if we care at all about getting rid of prison, we should go down those paths and save those young lives and fix those dysfunctional families. But we don't have that going on in the prison system. What we're doing with people once we incapacitate them is illegitimate. And so it's contrary to public safety. So call it prison, call it a reformatorium, call it a gulag, call it re-education camp, call it whatever you want. The effect of prison is the same anywhere in this world. When you chain and cage people, it's the same. And so we have to figure out what we're trying to do with our punishments and what we're trying to do with our reformation, and then try and I know reforming is, I don't have a better word. We have to take what we do. Obviously, if you have somebody who's eating other humans, we have to do something to get that person fixed and to stop other people from being harmed. I don't know how to do that. That's way beyond my specialization. I've been out of prison 6 years, so I'm actually 6 years old. My rebirth day was February 17th, 2016. And so I tend to look for signs about what I'm supposed to do about something. And often I find that those signs come from the darkness that was my past. And sometimes when things are happening with me, I don't know at the time why they happened. So I carry them around like a companion, and eventually I'm able to say, oh, well, that's why that happened, this right here. So we have to figure out a way to heal everybody, because I know it's a cliche now, but hurt people. And every single young boy that I ever met in foster care, I met later in prison. Every single young boy that I knew in prison or in foster care, I knew in prison later. There's something wrong with a system that's that predictable. And if we want to fix, I mean, it's like the defund the police. It scared the hell out of everybody. What do you mean, no police? What? You know, who's going to help us? But maybe we should be talking about what constraints. We have to get rid of qualified immunity on all the rest of that, opening up their personnel files to the public. We should have citizen review boards. And reform is not a word that people want to readily accept, but you have to take that money that the police are getting to militarize the police. They're buying tanks for San Jose Police Department, $800 million worth of military equipment over 8 years went into San Jose. Tanks and you know, heavy arms. We need to divert that money and create units where trained psychologists and other people are dispatched on calls with people that are having mental breakdowns and things like that. In that way, we figure out what police are supposed to be doing and how they can do it safely without killing people. You can't pull people over for a broken taillight and 10 minutes later they're dead. I mean, how did that happen? A broken taillight, how is somebody dead? You know, seriously. So yeah, we have to figure all this out. It's not an easy thing. And maybe we have to invent a new word.
Yeah.
Maybe.
Yes. You know, you're talking right now about within the carceral system, but let's think about in the healthcare world, we look at the fact that the United States is #1 in preventable death and #1 in preventable disability. And who decides that? These are not people in prison. These are wealthy people. These are people getting $50 million salaries as CEOs of an insurance company. These are politicians. These are
doctors,
the people in the pharmaceutical industry who are deciding that diabetics are going to die because the price of insulin is going to go up 600%. So, you know, the gun shoots both ways. We talk about those in prison who commit crimes and are the cause of death and destruction. But what about those sitting in these positions of power, allowing people to die in this state and across the world, the vaccines that are not available to people in other countries because of pharmaceutical greed? There are people making these decisions. These corporations have people making these decisions, and they are deciding in our healthcare system to let people die, to deny their care, to delay their care, to make their treatment unaffordable, to make their medications unaffordable. These people are not in prison, but these people are responsible for a lot of death and destruction. So I think we need to think about that too. Let's focus on the whole society. I do have a question related to the healthcare as well. And that is, what do you see as the most significant barriers to healthcare, to getting the care that they need when someone is in prison? And then also when they're released and re-entering, what are the barriers to care that people are suffering with? I've read it that I know the Marshall Project talked about how humiliating exams are when prisoners are stripped naked in front of 5 or 6 different people. Their physical exams are quite public, where people are in handcuffs when getting treatment, when prisoners, their concerns are denied, when they're afraid to say that they're sick, because sometimes when you say that you're sick, you end up in solitary confinement if it's a communicable situation. For instance, COVID, people were afraid to say that they had symptoms because the treatment, if you had COVID, was solitary confinement, which is torture. So, and that there are often a lot of waits for people incarcerated. Now I know when people re-enter, it's a very complicated system. I don't know how anyone copes with it coming out of prison, how you cope with getting healthcare. So maybe you can tell us a little bit about that. Either of you, Geri, do you have anything to say about that on re-entry? Or I know in your program, in your KPFK program, you interviewed a lot of people, and just wondering if difficulty getting healthcare was an issue.
Just from, you know, it's certainly not, don't have Marvin's take on it, but I do know things that I've heard as in historically, I don't know if Marvin knew Big Ernest Shepard, but he was part of the, guess you'd call it the radical prison movement in the 70s. And he was asked to go into the work in the hospital because of the treatment Black prisoners were getting inside the hospital, or shall I say Black incarcerated people. But that COVID was such a great example, just like what you just said, Maureen, about people not wanting to report that they had COVID and not getting the test because of the treatment they would get, where they would be put in these god-awful positions. One man was beat up by his cellmate. He was beat up very badly by his cellmate. They never gave him the medical treatment he needed. He's forever maimed, shall we say. Another person that I know is an LWAP. He has really bad knees and he had to have surgery on them. They did the surgery all right, but then they forced him to go back to work, which was pushing someone in a wheelchair very soon after, and it negated everything they did for him. You know, I guess when the guys that I work with that are home, most of them don't have, you know, enough money and have to get on Medicare. So, you know, they get, in many cases, substandard treatment with Medicare. It's, you know, as bad as it is overall, it has to be 10 times worse inside. But I don't have all the details on that, and I know Marvin does.
Yeah, well, there's a lot of things that conspire. Of course, we already know the reason we need single payer healthcare is because the system tends to exclude marginalized people and communities out here. And how much more so marginalized are you if you're chained in a cage behind walls? Those walls don't just keep people in, they keep people out. And the fact is, you know, most of the prisons that we have in California were built before we had regulations on things like lead pipes and paint. If you live in San Quentin, if you live in Folsom, Soledad, Tracy, DVI, any of those places, Chino, the water you drink is coming out of lead pipes. We have clusters of these weird cancers all over the prison system. Guys are getting brain cancers and cluster tumors and stuff, and people can't understand, where is this stuff coming from? Well, we've always known it's the water that we're drinking. And I had a stroke in 2007, and they took me to Marin General because something happened at the doctor's hospital where they couldn't take us there that day. So they took me to Marin, and I got a shot that my whole side was paralyzed. And I got the shot that within an hour or two started reversing the paralysis that was in my arm and my leg on that side of my body. And the doctor came in about 2 hours into the process. He said, you know, you're lucky that you got that shot because we're not supposed to give that shot to prisoners. Yeah. I said, really? And so I said, I said, so why did you give it to me? He said, because I'm a doctor. And so that's why you got it. But it really made me start looking at what we're doing. We had been fighting for a long time to get our medical care down to a standard that wouldn't kill people. We filed administrative appeals for almost 8 years until we got to a superior court, and we were able to pass off our fight to the prison law office. Jane Kahn and the people at the prison law office ended up filing a class action on behalf of the prisoners, which ended to them being put in receivership. And they had to release 36,000 people from prison because of that lawsuit. And they're still under receivership today. Everything from healthcare to mental health care to Americans with Disability Act access, that kind of thing. They have cases where the Department of Corrections is being monitored, but that's even bad because once you leave prison, you don't even have that protection anymore. You don't have a parolee out here that can say, oh, Plata says, well, Plata has nothing to do with you. You're not in prison. You're out here on the streets. I was working on a project. I was consulting on a project where we were matching people coming out of prison with community hosts that had living spaces. And we had a grant that would allow these hosts to get a daily stipend to house people coming out of prison. And it was a true reintroduction to the community. It wasn't some private prison transitional housing place like Geo or Core Civic or any of those places. This was when this person came out of prison to this host's house, they immediately inherited their neighbors, their community stores, the churches, everything. It was a true introduction to the community, and the money that they got, the host got, went right into the community. It did not go through some private prison. And so I thought this was a really great project. But we, in preparation for that, we went and talked to homeless people, and we found that 84% of the men that we talked to over a 4-month period in San Francisco and Oakland, 84% were incarcerated directly before becoming homeless. And more than 50% of the women were incarcerated directly before becoming homeless. And the rest was all mental illness and drugs. So if we really cared about things like homelessness, access to medical care, and insurance, then we would do something about what happens to a person when they come out the front gate. The state's job is not over when the gate slams on this person and they go into prison. It's going to open again, and they're going to come back out. And if they would expend just a piece of that 13 billion, this year is going to be $20 billion, just a piece of that to this side of the process, they could shut 2/3 of their prisons, because we could show you how to make these guys and these women coming out successful, give them a chance to self-actualize. When they're in prison, they're not, there's nobody in there. Rehabilitation, in my view, does not work for the most part, because the book definition is to return somebody to a place of wellness or well-being. And most people in prison have never known a place of wellness or well-being. You're asking them to go back to some place they've never even been. We're making a big mistake there. So maybe we should be habilitating people. Then when they stray, they can find their way back to that point of habilitation. But it's ridiculous to tell somebody to go to a place that they've never been, unless you're willing to lead them there. Which
Yes,
is what we tried to do at the front gate. We try to help lead people to that place of self-actualization.
yes. You know, even in the LA County system, people on Medi-Cal are dying from lack of care and from having their care delayed, and those deaths are not counted. At least I think since the receivership within a prison, those deaths are being counted. And people have said, I didn't know how true it was, that actually they could get care while in prison, but once released, it was really, really difficult. I actually ran into a young man who had diabetes, and he told me if he could no longer afford his insulin, he was going to commit a crime so that he could go to prison and stay alive, which is a pretty horrible thing to say about the state of our healthcare. So about an estimated 80% of prisoners are poor, right? And in many prisons, there are co-pays and fees for medical visits, which is another reason that prisoners don't often say when they're sick, and they will put up with pain for a long time because they have to pay these fees that come out of the very little money that they have. And that money is used for things like soap and new underwear and things like that. So is that the case in California? It is the case in California. So the same thing that exists outside prison, which is fees and co-pays and deductibles that people cannot pay, prevent them from getting the care they need. So the same thing happens in prison. And people dying outside of prison because of delayed care are not necessarily counted. And that had been happening in prisons before the receivership. So it's interesting how we say there's a wall, but it doesn't look that different when it comes to healthcare for people inside and people outside. So I guess should open this up to a few questions. We've gone quite a bit over time, but are there any questions? Paul or Erica?
Paul, I don't have any questions on Zoom.
Okay.
Paul, do you have any questions on Facebook?
No, I don't.
Okay, I do have a question then. I want to know, since the receivership in 2005, have you seen an improvement in healthcare available to prison inmates? Did you notice any change, Marvin, while you were there?
Initially, they tore down the library at San Quentin and put a hospital there, a $222 million hospital. And initially there was, but the receivership is turned into a corporation. It is now incorporated, and it's big money. And you have people who used to be Secretary of Corrections now running things there, and how insidious it was that, you know, I mean, it wasn't even insidious. I think it was in plain sight. I think the last 4, 5, 6 years has probably revealed how people have been doing things in plain sight, and it just like they just do it in plain sight, and people are like, well, okay, he did that, you know. But healthcare in prison is driven by each prison is a fiefdom, and each warden is the king of that fiefdom. And you have a chief medical officer who is the warden of medical, and then you have the warden proper, who is the head of security and custody. And sometimes they don't agree on things. The medical department will say that you need these breathing machines, the CPAP machines, if you have sleep apnea. And then you have some wardens that say, you know what? I'm not letting that thing in our cell blocks. They could make weapons out of it. So they take them away. When COVID happened, they went around the system. The receivership recommended that they take away people's CPAP machines, and they did. And if you didn't want to give it up, you went to administrative segregation, where you could have your machine, but you were going to be locked up 24/7 in that hole. Those are the kind of decisions that should not be made by a medical department who had everybody there had sworn to first do no harm. And the warden should not be involving himself in removal of medical equipment. We sued them behind that, and many other things that they've done. We could have a week's worth of shows on the things that happen in prison with people's medical care. If you have a person that is dying in prison, or has dementia and is dying, and they have 17 beds in a system of 127,000 people. They have 17 hospice beds in the Department of Corrections. Palliative care is non-existent. There's 17 beds at the California Medical Facility. So their odds of getting one is just astronomical. But most people choose to stay in their cells with their cellmates who they've known for years. And their policies are like, if you die in your cell in prison, which is where most people die, if you die in your cell, your cellmate goes to administrative segregation till after the autopsy, which is sometimes several weeks. So here's this person who has just lost somebody that he's been with maybe 10, 20 years, has to start their grieving in solitary confinement, if they even know how to do that. Most people don't even know how to grieve. And so those kind of policies, that's just one thing. People don't want to go to the hospital while they're in prison because they will pack up all your stuff. Whoever the officer is rolling up your property will keep half of it, saying, oh, you're not supposed to have this and this and this. And oh, you have 2 of these, you're only supposed to have 1. When you come back out of the hospital, half your stuff is gone. You're unassigned from your assignment. You're in a different cell. You don't know the person you're being celled with now. And so people just stuff it. They don't say anything. They suffer. And
what do you need?
Like your help.
so,
All right.
I just think
The cruelty, I mean, it's just unbelievable.
it
the
is. So we have
cruelty.
to fix these things. And I don't know, Jerry and I and a lot of other people out here know that these things happen because there are people in prison. I can tell you, people tend to reify an individual's offense and make that an attribute of the person. They may have done bad things. They're not bad people. And that's the distinction right there. But there's people in there I'd love. I'd love them. If you think about people you love the most, there's people in there that I love like that. And so I had a Stanford professor ask me, if you've been cleared, why do you still identify with these people? And I said, because I was a prisoner. I was a prisoner for 41 years. That's not going to change. That's never going to end. I mean, that's something that is permanently, in me. And so, I think the best way we're going to fix all of this, how we can replace what we're doing with some type of a system that is going to fix brokenness. And you're not going to be able to fix brokenness until you become proximal to it. So you got to tear down these walls that are dividing the public from these cages that they're paying for, and make everything totally transparent. And anything that I tell people all the time, if you don't like what you're hearing, then do something about it. That's your prison. Those are your wardens. Those are your guards. Those are your prisons. If you don't like what's going on, do something. It's your prison. And
that sounds exactly like what we're dealing with outside with the healthcare situation. It occurred to me that California's prison system is the most expensive one in the country, and probably in many countries even. It's $3.6 billion, right? Which is more than Texas spent. That's just for medical care. So we have the most expensive in-prison system, and we have the most expensive out-of-prison system. So we also have a staff of 57 to monitor health conditions. And yet everything you're describing and everything Geri has described doesn't look like that monitoring is really, that really has any good results. So I'd like to ask you for your last comments on anything you'd like to say. I just want to say that
Actually, before last comments,
Yeah.
Maureen, can I make a comment?
Oh, yes, yes.
First of all, thank you. I think, I express gratitude from everybody on here, and thank you so much. And I did drop this in the chat. There are abolitionist candidates running in this election. And, you know, as activists, we're always in the position of begging the elected leaders to do the right thing, to do the humane thing. And I'm very excited about these candidates. People's Budget Los Angeles had a candidate forum. I know, Maureen, you were there on Saturday. And it's incredible. I dropped some of the names. Gina Viola is running for mayor. We have Kenneth Mejia running for city controller, Faisal running for city attorney, several abolitionist city council members. And this city right now, the candidates that get all the mainstream media, they're doing the same old thing that we've seen forever. Geri, I know that you were a part of the fight for Measure R and Measure J, where the people decided to give 10% of the LA County budget for care. We need to elect these people into office to make that happen. And so I just, you know, wanted to point out that on the shoulders of the work that Geri, you've been doing, and Marvin, you've been doing, you know, things are building, and there is, you know, like our title says, hope and healing and health. And there are incredible abolitionist candidates, not reform. They don't believe in reform. We've got to dismantle the system and reimagine and build, and we need care, not cops. So I just wanted to highlight that is going on with these elections and encourage everybody to check out the candidates.
That is revolutionary, what you're talking about, and that's how you fix a system. You infiltrate it. Seriously, there's no other way to do it. They have something for you if you think you're coming down the street and tearing down City Hall. They have something for that. But leave City Hall standing and fill those offices with people that are going to do justice, that are going to do the right thing, that are going to respect humanity. That is revolutionary. I was on Chesa Boudin's campaign team, and this person being DA in San Francisco, that is revolutionary. I would help Gascon. I'm on a campaign right now in Yolo County to try and get Cynthia Rodriguez in as DA. And these progressive DAs, that's revolutionary. That's how you do it. That's how you do it.
Thank you so much. Geri, you have a comment to make?
Well, I was just wondering, would this organization have those candidates, or maybe just the city council candidates, get on and talk about their views on healthcare?
Well, they had a forum on Saturday, People's Budget Los Angeles, but you know what? Let's have another forum. And let's, you know, hold it again and do it again. You know, I actually see Iapo's hand up. She must have hopped on, and she's Gina's campaign manager. Do we have time to take a question, Maureen?
Yeah, I think we do, as long as Geri and Marvin are okay with staying on for a minute.
Yeah.
You okay with it? Okay, sure. Is this Iapo?
Oh, Iapo, you're muted.
Sorry about that.
There you go.
So again, greetings everyone. My name is Iapo Moyende Ngina, and I am functioning as the campaign manager for Gina's mayoral run for the mayor of LA. And I really appreciate this discussion. I came in a little late, but I caught enough of it to be, you know, really moved by the discussion, and it really hits home. I was married for some years to a political prisoner, and you know, it's actually an issue that's really close to me in several ways. I appreciate the discussion around the quality of health or lack of quality of health inside these institutions. And I just had this conversation with this young woman the other day who works primarily with young gender nonconforming, non-binary, and trans young people who have been incarcerated, and who this organization specifically deals with the kind of trauma that is peculiar to them having been incarcerated. And the question of healthcare in general is one that is so beyond urgent in the general population. And so sometimes it becomes almost background noise to talk about the horrible conditions that people are forced to live in while they are, quote, doing time in these institutions. And, and we just take for granted how extraordinarily inhumane and vicious these systems are. Women, being forced to deliver children handcuffed to beds for days on end. And my ex-husband was vegan when he was locked up. And, like not even attempting, there's no process for a person to be fed if, for religious reasons, they don't eat meat, right? So those things that we just really take for granted. I had done abolition work and, a lot of work around the hundreds of political prisoners that still linger away in these institutions. I currently am a volunteer on the campaign to free Leonard Peltier. I have been for years. I've worked with the Jericho movement, and, to think about even Leonard Peltier is in his 80s. And when I got onto that campaign, he had been transferred to Florida, guaranteeing that he would never see his family members. They would never have the ability to visit. And seeing the emotional trauma as something that is a facilitator, if you will, a precipitator of men and women's health conditions inside these prisons, right? We know now, I'm also, for people who don't know, I'm a doctor of Oriental medicine. So that is medicine is my lane. And so the impact of trauma, we associate PTSD with like combat or, rape. And we don't see what is happening to 2.1 million incarcerated people as contributing to PTSD, and without any ability for them to seek the kind of help, whether in prison or outside of prison, that they need to address that kind of extreme trauma. So I just really appreciate the conversation. I really appreciate the discussion.
Thank you. Maureen?
No, I just wanted to know if Geri had any final comments, or Marvin had any final.
I appreciate being able to be with you on this, to be able to speak, my truth about this beast of a system that we live under, to be able to be heard, not as a reformist, but as somebody that knows we've got to tear it asunder, and having some people agree with that. Because until we do that, we're in deep, deep trouble. You cannot reform this horrible healthcare system. It affects everybody. So thank you for having me on, and yeah, appreciate it. I appreciate you, Maureen. You are amazing.
No, I just know how to find amazing people,
No.
of which you are one. Geri, I want to ask you one thing though. I listened to your program. It's nice to see you now, on and off over the years. And how can we get your program, Thinking Outside the Cage, back on KPFK? Can you put something in the chat?
You bringing that up. I writing letters or calling the general manager of KPFK, and asking to have it back on. I guess think outside the cage. I mean, there could be so many good programs that I could be doing about not only healthcare, but mental health, having the candidates that are running for office that are abolitionists go one-on-one with the men and women inside, dialoguing. That it's just so important, so important to get their voices out here, because they're lost. They are lost, and I'd appreciate anything you can do. Thank
So
you.
everybody that is interested, Jerry had a fantastic program on KPFK. I thought it was one of the most important programs I had ever encountered because it gave voice to the voiceless. It was the first time I heard people in prison, currently in prison, on the phone for like, 3 minutes or something, and then the phone would go off and they'd have to call back another 3 minutes and then the phone would go off. Incarcerated people talk about the deep humanity that was promoting the reforms and the changes they were trying to make within the system, and to explain what it was like to be there, exposing the humanity to the public of these people who are trapped in the system was so important. And it was the only program I know like that. So please contact kpfk.org, general manager, tell him that you would like Think Out of the Cage back on. It was the only program of its kind. And we need these voices. We need these voices. So
Well, you know,
thank you, Geri.
Maureen,
Yes,
I'll
Marvin.
tell you that we are not, when I talk to people who are abolitionists and I talk to people who are not because they're afraid, I tell people all the time that I'm a big believer in dialectic. I think that everybody's voice has to be at the table for everybody to eventually meet in the middle and find some middle ground that's going to help everybody with their needs. Abolitionists are saying simply that we cannot continue these torture factories, these snake pits that we maintain. But we have other people who are scared because this is what they do. They fuel our fear on the news every night. That everything that they tell us, the politicians and other people who control the carceral policies, have people convinced that we need this, or else everybody's going to be slaughtered by these animals, right? These super predators. But abolition can happen simply by going down those paths I was talking about, finding the root cause of this brokenness. Stop breaking people's lives as children. This system is self-perpetuating. It eats its young. It will create at one level what it needs at the next. And if we can interrupt that supply chain, if we can go and find a way to stop the hammer that is cracking people's lives, we won't need prison. So, and I'm going to tell you, this is, well, mass incarceration has its roots in racism, because the marginalized communities around California are the feeding grounds for mass incarceration here. And they happen to be filled with people, brown people, because of our social and economic biases. But don't make this mistake. Mass incarceration is socioeconomic. If the marginalized communities around California were filled with white people, prison would be filled with white people. You just have to be poor and vulnerable. It just so happens that the brown people we have in these marginalized communities are poor and vulnerable. And so we have to fix poverty. We have to fix these. We have to take the hammer away that's cracking people's lives open, and then you can abolish prison, because you won't need it. There's not going to be these people who are crawling in windows and killing whole families because somebody broke their life when they were 9 years old. You know, it's just not going to happen. We have to fix that part.
Thank you so much, Marvin. You are so on the money, as is Geri. I just want to remind everyone that 100,000 people a year die in the United States, at least, from the broken healthcare system, which is in complete control, which the CEOs of these corporations are in complete control, and our politicians are in complete control of these 100,000 lives that we lose every single year in this country. And those are the people I'm afraid of. And those are the people who are impoverishing entire communities. Those are the people that are bankrupting families. Those are the people denying and delaying and getting healthcare impossible so that they can make an extra dollar. And those are the people I'm afraid of. So thank you so much. Really appreciate you and all the work that you do, Geri and Marvin, so very much. And thank you, Iapo, also for the work that you are doing. Really appreciate it. And wish you all well. We need single payer. We need transparency. We need the same healthcare for everyone. Everybody in, nobody out. No pay to play. All lives are of equal value, and we have to cherish one another and put the care back into healthcare. So thank you so much. Really appreciate you for educating us tonight. Thank you.
Thank you.
Good night, everybody. Unmute and say good night. All right, unmute. Good night.
Good
Good night,
night.
everybody.
Good night,
Good night,
everyone.
everybody.
Take care.
Thank you, Maureen. We
Thank
love you.
Love you
Thank
all.
you so much for
Bye-bye.
having me. This was wonderful. Thank you.
And
Thank you.
Thank you to the speakers who came.
Thank you, Marvin.
Very good, very informative.
And 1, 2, 3, we're off.